Hello, everyone. We are live at Dear Pandemic. This is Malia Jones, and I'm joined today by Lindsey Leininger, fellow nerdy girl from Dear Pandemic, as well as our special guests, Dr. Vineet Arora and Dr. Eve Bloomgarden, the co-founders of the Illinois Medical Professionals Action Collaborative Team, or IMPACT, which is a coalition of physicians and health professionals working to engage grassroots networks, advocate for evidence-based solutions, and advise influential stakeholders, and amplify solutions that protect all of us. And I'm just going to do some formal introductions, and then we'll have a little informal intro about how we all know each other. Dr. Arora is a professor of medicine, academic hospitalist, and associate chief medical officer for clinical learning environment at the University of Chicago. Her work bridges educational and hospital leadership to engage frontline staff into the institutional quality, safety, and value mission of her organization. And she's been busy responding to the COVID crisis, listening to her networks of physicians and supporting frontline staff who are responding to the crisis. And Dr. Bloomgarden is an endocrinologist at Northwestern Memorial Hospital. She's a clinician and educator and has been involved in public-facing response to the COVID crisis. She's treating patients with endocrine conditions, and she's also been advocating for physicians and communities via social network platforms. So thank you very much for joining me. And like I said, I'd love to do a less formal intro of how we all came to be together and get involved in this work. Lindsey, you want to start us off?
I do, and I want to start us off from like circa 2002.
Oh God.
Is that right, Vinny? Not to, miraculously we've managed to stay 29, but we met in 2002.
Like, are we giving away too much? I think, is that right? Yeah, maybe you're right.
It's right, yeah.
Right, yes, that is correct. 2002.
So Vinny and I go way back, and we were both graduate students at the University of Chicago's Harris School of Public Policy. And we were both interested in health. She was an MD, so she had kind of an interesting different path. I was much more just my head in the data. And we had great fun, and we've been friends for a long time. But that's not how we got connected. We got connected via Eve. I lived in Chicago for a long time in the northern suburbs and had been hanging out on the Moms Facebook group. And Eve had been hanging out on the same Moms Facebook group.
True.
And when I wrote about Dear Pandemic with this wonderful group of women, and North Shore Mom Spot, if there's any of y'all listening, I just want to give you a huge shout out for being like
Absolutely.
The biggest, awesomest like forces
platform.
Of good. Yeah, exactly. For Eve and me. So thank you. So I was like, I've joined this group called Dear Pandemic. We push out evidence-based information. We help you deal with the information overwhelm that's going on as the pandemic rages. And Eve found me and reached out and was like, I'm doing something similar, but with a physician group. Let's connect. So we connected, and it was like kindred spirits right away. And then lo and behold, one of her co-founders was my dear friend from the Wayback Machine in 2002. So that's the origin story of our partnership with the amazing physician leaders at IMPACT.
I love it.
And
that's
our
amazing.
story is actually similar in the sense that we definitely mobilized moms on social media. So one of our other mom friends, Laura Zimmerman, is the founder of Physician Mommy Chicago. And so what happened for us is we just were distraught, seeing in our hospitals the issues around social distancing, preparing for COVID, and the mommies groups in Chicago were then watching as revelers were celebrating St. Patrick's Day in Chicago. O'Hare Airport, was congested because of the new travel visa regulations that had gone into place, and we were one of the ports of entry, and people were just like, they'd had it. They were like, what are we going to do? And so several of us, somebody tagged me and said, well, we can write a letter. And that's literally how it started. And so, so I did.
And that's exactly right. I was on the phone with our state representative that somebody in the North Shore Moms group actually put me in contact with. And I was trying to paint a picture of what was going to transpire and what we all needed to do immediately. And I had one of our other co-founders, Malia, on the phone with me, and she mobilized her kind of immediate action plan, I think called Vinny at like 3 in the morning that night or something. And
I was
and
awake.
just said, and just said like, what are we going to do? And I know Shika Jane, who's one of our other co-founders, and we kind of just all kind of morphed together in the middle of this crisis as we were watching things kind of unfold. And it was in the exact same kind of moment that Lindsey and I had connected. So it kind of just all worked out really well to have these two groups kind of working together. Yeah.
And I should note, in the interest of like full transparency, I'm a scientific advisor for Impact, in addition to being a nerdy girl. So
thank you.
There's no COI, but just, transparency.
Appreciate your transparency. Yeah, I remember back to those days in early March. I was on vacation in late February and came through the O'Hare Airport on February 29th. And I had been looking at what was unfolding and kind of knowing that something big was coming. We even considered ending our trip early so that we could get home. And God, coming through the O'Hare Airport on that day was a scary experience. It was just chaos, and clearly no one had a clue what to do. And so we, I think what happened was we all got sucked into this vacuum of to fill a real need for practical information.
Absolutely.
So
absolutely. And I think our role as parents, and our professional roles made us we were in the perfect position.
Yeah. So I'm really excited to talk to you both in particular because I am an epidemiologist, which means I study how I study the interactions between people, right? How groups of people become sick or stay well. But I really know very little about what happens inside the body and patient care. So it's like not what I do at all. And, Lindsey does a lot of policy work. And so that's even a whole other level of in terms of the hierarchy of how the healthcare system works. And so I really am excited to hear from you about the physician experience. And so one of my first questions for you is just, I want to hear what about seeing a COVID patient is different? How are your networks of physicians describing this? What's different about it in terms of presentation when you see a patient compared to something like the flu?
So I can take that one. That's a really, really interesting question because we don't see a lot of what's happening in the hospital as outside of the hospital. That's not really something that we're seeing on the media. It's not really something people are intimately aware of. I think from my perspective as an endocrinologist, when I'm seeing patients, when I've seen patients with COVID, either it's been a tele encounter because they're well enough not to be in the hospital, or it's been in the hospital and they're very, very ill in the ICU. And so I think the extremes of what I'm seeing is not really going to answer the question as well as it should be answered. And so I'm going to do my best to try and depict what my colleagues have seen, especially in the ER and in primary care. I think, COVID-19 is a virus that can do almost anything. I mean, so the presentation can be very varied. You have to obviously be really thinking about what the patient's telling you, and you don't want to miss something like a heart attack because you're thinking only COVID. But the most common presentation is really just this respiratory distress. So people coming in really short of breath, having struggling, we call it air hunger. And that's one of the descriptors that I've heard from a lot of frontline workers as one of the hardest things to watch. There are lots of other manifestations of it, but that's the one that I think we really focus on because it's the one that's the most urgent, or it's a true emergency when someone is air hungry. The ERs have, I would say, completely revamped everything they do to triage and to take care of these patients, in particular, all starting in New York City, when all of this, when everything started and when New York was just exploding with cases. I think everything they did on day one is something that is now done differently. And everything that we've learned about how to manage these patients has really come out of their hands-on experience.
Yeah,
in
that's
March
actually
and
my
April.
next question. So let's just put a pin in that, and because I want to hear more about what's changed. So, but first I want to give Vinny a chance to respond. What are you hearing about from your networks of physicians?
Absolutely, thank you. I would say it's interesting. So just like you guys are specialists, Malia, and Lindsey does health policy, and you do more public health. We're specialists too, and so one of the things that we've seen is that COVID is a rapidly evolving disease. We're still figuring things out, and two things that have come to light are the need for special information for the front line, and so the information has been changing so rapidly for frontline doctors. Initially, there was this question in hospitals about, well, how would we outfit the ER? Then they get admitted. Okay, now what? We've had to have hospitals rapidly stand up what we call COVID units, where the unit is basically just COVID patients, COVID positive patients. That doesn't mean that you might not see a COVID positive patient, because there's a designation called person under investigation. This may sound like a term that
criminal.
It is, yeah. It reminds me of, in epidemiology, we're always talking about surveillance, which I think makes people feel very
so creepy.
It's not my term, it's the term the CDC started with. So the first time I heard it was from our hospital epidemiologist, and it's abbreviated PUI. So persons under investigation, COVID positive patients. The reason that's important is when you didn't have testing, it was like, okay, you were waiting for testing, but you'd still have that person under investigation. And so the question for hospitals, particularly when PPE was in such shortage, and I do want to say it's still short, it's just not as short, but when things were really tough in the beginning, when people didn't know, one of the best practices that people started doing in hospitals was to stand up these COVID units. And so as a way to conserve PPE, but also to get specialists in there, ICU specialists, hospitalists, others who could specialize in the treatment of COVID. As the numbers start to rise, you convert more of your hospital beds to COVID units. So then that's a challenge, because what do you do with the other patients, right? There's still people getting sick coming in. And so I think what sometimes people don't understand is it looks okay on the street right now in Houston and in Arizona, and it's sunny and people are at the beach, but it is not okay in their hospitals right now, as they're starting to figure out how to deal with the onslaught of COVID patients. And so back to your question about what is it, I would say that one of the hardest things right now is that for physicians who are on the front line taking care of COVID patients, they don't have time and energy to tell us what they're seeing. We had set up a library consult service to be like, send us your questions so that we can answer the literature from the best practice literature for you, because the literature is evolving, there's preprints, but literally that's the type of support that the front line needs, because they're just dealing with the onslaught, that those stories about what's going on in Arizona with frontline doctors, you see some of them, but honestly, one thing that disturbs me is I go on Facebook and look at my friends who are doctors in these areas, and the last post from one of the hospitalists in Florida was like, pray for us. They're going to disappear for a while they're dealing with this onslaught of COVID patients.
Right.
I think that's a challenge, because people, because of legal reasons and HIPAA, a lot of privacy issues, we don't let people into hospitals to watch this. But if they did, maybe they would just wear a mask, or maybe they would socially distance, and maybe they wouldn't go out to the bar. And those are the things that as doctors we're praying for.
Yeah.
And I think that's absolutely right. And also, I think one of our roles in Impact is to try and support our colleagues and physician, friends, and in helping taking information from point A to point B and trying to assess the need. And we've been working on from that angle to really try and help when we hear what's going on as well.
Yeah. So, Vinny, you just said something that piqued my interest. You said that it's such a rapidly evolving disease. And I think what you meant there was that our knowledge about it is evolving very rapidly, and not that the disease itself is evolving really
Correct.
rapidly.
Thank
Is
you.
that right?
Our information about the disease
Yeah.
is evolving rapidly, correct.
So in your view as a physician, what have we learned over the last 3 months or so?
You know, I would say that, you know, I'm not an ID expert, so I do want to qualify that, you know, and I would defer, you know, definitely say that there is a lot that's still being learned, but I would lean on sort of our nation's doctor, which is Dr. Fauci, who's a giant in our field prior to the COVID pandemic. So, so for those of us that are doctors, we've been following.
And also in some sense, my boss.
Oh, right.
Your boss, okay.
She's funded.
I'm funded by an NIAID grant. So
there you go. Okay, so,
Amazing.
many of us have his textbooks. You know, he's been an editor on major textbooks in medicine. And so he has always highlighted the need for humility about what we know. And so a great example is, you know, thinking about these, you know, medical myths. Right now, people are talking about how young people are getting sick and therefore, you know, you know, there's a lower mortality. We don't know that, you know, that this is, you know, people are making really big assumptions in the moment, especially around indicators that lag, like hospitalizations and mortality.
yeah.
So
this is one of my very favorite points to hit with Dear Pandemic, is that just how little we really know about a brand new disease. It's really challenging.
So I would
this is not common. I mean, we don't encounter, you know, anything to this scale that is a new unknown, you know, that's a new disease that we have to learn everything about while actively taking care of these patients. This is something that's really, you know, unprecedented for many physicians. You know, it is similar, you know, Dr. Fauci was part of the response to the HIV/AIDS pandemic. And, you know, that I think it makes him so well qualified for this, because he did see what that did when, you know, in the 80s when this was all starting. But a lot of us did not see that, or, you know, I was still in school. You know, we saw that kind of the end of that in training. And so I think just the pace of change and the influence of the non-medical, non-scientific world on the information being shared and conveyed to the public, I think is really unprecedented.
Yeah, I think that's very clear. I'd love to get both of your perspectives. And Lindsey, I know you have a perspective that I value quite a bit too, about this idea that we're dealing with an infodemic as well as an infectious disease pandemic, right? And this idea that those of us who are everyday people are just sort of awash in information, and it's very hard to evaluate that information. So I'd love to hear your perspectives on that.
Sure. So yes, so I as an endocrinologist, my practice has really pivoted to 100% telemedicine for my outpatients. And so I get a look, you know, I talk face to face on the video screen, just like we're doing now with my patients. And I'm astounded to hear that some of the information that I think is just so obvious and clear that everybody must know is really not known. So things like at the beginning, washing hands, things like wearing a mask, social distancing, you know, please don't go to X, Y, or Z location, even if it's open, being strategic about the supermarket. And I think half of what I do, even though it's nothing to do with why I am, you know, the disease or the issue that the patient's seeing me for, I am just educating my patients on how to live in a COVID world. And I think we can't assume that everybody knows what we know, and it makes a big difference to continually to say the mantra over and over about, you know, to stay smart. We're modeling our mask wearing and just repeating that, even if you think somebody knows. And I'm trying to just be really, really consistent with my messaging to all of my patients, and no blame, no fault if they don't know, but just to make sure that we're giving the constant message, because it is hard to find the truth sometimes through all of the misinformation.
And can I riff on that for a minute, Malia?
Yeah.
So those who are watching who read Dear Pandemic somewhat regularly probably recognize that I take the infodemic beat a lot. And that's because my entire career has been spent helping leaders do diligence on health data. That is my entire career. I have helped policymakers think through health data, Now I get to help the public think through health data. And I do think that we need to teach critical thinking skills in addition to just swatting away the ad hoc questions, because there are way too many questions for our physicians to have to answer every single, primary care encounter or specialty care encounter. So when we started this whole thing, Malia, when you started it, Malia, and I joined in, one of my personal missions is really to help people bolster their critical thinking skills.
Yeah. And scientific literacy too, which I think are not exactly the same thing, but are closely related, right?
Closely,
and a lot of us don't have biology in our backgrounds at all, and so it's like, how could you think critically about these issues?
I mean, I'm a thyroid specialist, and I can tell you that from the world of misinformation on the thyroid gland available on the internet is probably it's just kind of one of the most confusing things. I call it the landmine of misinformation. So half of what I do when I see patients for the first time, I say, please don't Google thyroid. I apologize if you already did. You're going to encounter a lot of books, a lot of supplements, a lot of advice, a lot of things that don't make sense. It's impossible to weed through them. Without being a thyroidologist, you're not going to understand what's real and what's not real. And I think that just directly translates to what's happening now. In terms of, unless you have a really good understanding of how to critique the literature and you can really separate truth from untruth, which again, in an evolving situation, even the best of us are having trouble. It's hard to know where to go to get the right answer. And so, as a doctor, like, my patients are turning to me for this, even though it's not my specialty, even though that's not why they're scheduled to see me. And I think in the same way, epidemiologists and experts, we're all stepping into these roles that are maybe not exactly what we thought we would be doing.
Yeah. I think it's a real disruptor in terms of, I think a lot about the flow of information, and the pandemic itself has been a real disruptor in terms of how we get information, and especially with the speed. Vineet, do you have anything to add on there?
Absolutely. So another hat I wear in my organization is actually Assistant Dean for Scholarship and Discovery. So I spend a lot of time with medical librarians, teaching medical students and doctors how to cull information. And so I kind of think of you guys as teaching the public. And so I'm out there teaching our doctors how to deal with the quality of information. And one of the really interesting things about the pandemic, which I'm not sure others know, is that, the public has seen a lot of research presented, and one of the challenges is that sometimes the research is contradictory or hard to really follow. I've seen an explosion in news stories that have linked to preprints. So what are preprints? They're research studies that have not yet gone through peer review or been in a journal, and that it's an important advance, I think, because the journal publication process for medical research is so slow, and we're often, people often are like joke around, but this is actually a sad joke that it takes 20 years to implement something from evidence to practice in medicine. I'd like to think that number has gone down. Certainly with COVID, it has had to, and so we've had to try new things. And so, one of the leveling playing field there is social media. There's a lot of physician COVID groups where people have learned. And people are learning from Italy and China. In fact, our hospital has a conference. We're partnered with Wuhan. And so our ID experts have a conference with the Wuhan experts to be like, what are you seeing? What should we do? And our librarians have helped support that conference because of the quality of information that's needed. The challenge is that a lot of it is not yet reviewed, and it's still in that preprint stage. And so, because of that, and I did want to highlight that this is a great question for you guys too. As doctors, we face a challenge. We have to try, the medical establishment has to try what we can do to save patients. And so maybe we try hydroxychloroquine initially, but then we see the RCT didn't work, or there's a preprint retraction or something like that. But then we're stuck with, okay, the archive of websites that say that this works. And so you could see how this is a challenge, but we have seen good evidence get out there. And so we do know more about the disease and more about how to treat it than we did back in early March when this all started. But vetting that information also is a job. And so I think one interesting thing in our in our organizations, we've partnered with medical librarians to do that. And I've seen medical librarians stepping up. And so that's an interesting, story that I wanted to get out there.
That is
Can I
really
add
interesting.
one personal
Yeah.
anecdote? So I just want to, like, tying us back together personally, one of the first blog posts I wrote for Impact, the title was "Fight for the Front Lines by Fighting Back Against the Infodemic."
There you go.
It's true. Feels like a million years ago.
I
It
know.
wasn't.
It does feel like a million years ago. So, now I'm torn because I want to go in two different directions with my next question, but I think I'll pick my original tack here, which was to ask you, where do you think this has been a disruptor in terms of the way we deliver healthcare, either positive or negative, or sort of to be determined? I'm curious about how you see the system changing.
Ooh.
Well,
Because I think we're stuck with this for a long time.
I'm almost like, where do I think it's not a disruptor?
Yeah, I want to say that certainly, talking with Eve and, who's an outpatient doctor, certainly telehealth, and the whole focus on telehealth. And I should disclose that I actually had a baby during the pandemic. And so when I told, so totally dear pandemic, when Eve told me she found Lindsey, I'm like, oh, I know Lindsey. And when you talk to her, tell her I had a baby. I haven't gone public on social yet. And she'll probably be like, what? But, it'll all work out. So I know the timing of, as a mom to a 3.5-month-old, I know exactly how much time has passed because of when I had the baby corresponding to the surge. But I did want to highlight that telehealth is here to stay. Patients are demanding it. Physicians use it. And in fact, this is a positive, like it forced healthcare to modernize. I just got a call about a patient that I took care of, a few months ago on home health orders. And they were like, doctor, can I fax these over to you? And I'm like, ha, ha, ha. Like, I don't have a fax, I'm at home. And I was like, and they're like, okay, we can email it. I'm like, great. But just to help you understand that that's where we were before the pandemic hit, which is we were still faxing. And so the second thing that I want to say is that virtual learning. And so I'm a learning expert. And so we've seen a huge uptake in virtual learning, virtual conferences. More people attend virtual conferences. Mm-hmm. And so while we struggle to have attendance at some of these in-person educational conferences for doctors, we've actually seen bigger uptake on the virtual side. And those are a positive, as well as the continued engagement on social media, all positive for doctors to be out there using their voice to stamp out misinformation.
Yeah, I would say that's spot on in terms of, the positives. I think that we need, a lot of us were heading we're just in this, what's the word, state of overwhelm and constant kind of just like, got to keep going. We're a lot of us work on productivity and we just, there's so much happening. And this was like okay, nothing can happen the way it was happening yesterday. So how do we get really, really good at making these adjustments and changes and making sure our patients are okay, making sure our students, our trainees, our fellows, and all of it kind of happened on the same day. And so telemedicine for sure has been a game-changing experience for me. It's also been something we've been trying to get for about a decade and had hit roadblock after roadblock. And it was the actual reason why I was in touch with our state representative early on, was to push through a telehealth bill, because I was still seeing patients in the office and really felt uncomfortable about it because the patients were high risk. And so I think that has been important. I think the interesting part about medical education also has just been how quickly we've adapted to virtual learning and to Zoom. And there is actually a lot of benefit. There's, I would say, better engagement when you're looking at, your 3 or 4 small group members and you're just having a dialogue back and forth. You're sharing your screen. You're kind of just inviting them into my home and I'm invited into theirs. And I think that medical education in a lot of ways is not going to have the setback that we would worry about, because we've been able to kind of pivot platforms. The other disruptions that are not as good I think in terms of advancement and promotion and gender equity, especially as we talk about getting back into schools in the fall, is a major concern of, I'm sure, all of ours. I think Vinny probably can talk a little bit more about that, but it's certainly on the front of my mind.
It'd be a whole other podcast or a Facebook.
I know. I was going to say
we're at time.
We'll
come back.
We can come back to that one because it is a huge issue. So it's almost time to wrap up already. I had a whole bunch more questions for you, but let's just do one wrap up question. And I tried this format last time and you both said you liked it. So we'll try this format again. Let's go around and I'll give you a choice of a wrap up question. And here are your choices. What's been the best thing about the pandemic? What one thing can we do as members of the general public to make MD's jobs easier right now and over the next 6 months? And your third choice is, what do you wish you knew right now that we don't know already?
Are we answering all three?
No, you got to choose.
Choose one.
Okay. I was like, wow.
And quickly.
I'm a doctor, so I told Lindsay, I'm like, do I need to study? I'm gonna read up, and she's like, no, and I'm like, what? Like,
We're really good at studying.
So I will say, I'm gonna take the one thing that you guys can do to help us. Is right now is advocating for wearing a mask. I am, especially in these states with surges and reopening, like, we're not against the economy. Doctors are not against the economy. We want to reopen. Our doctors have small businesses. We have a lot of doctors with small business practices. We want to be able to open safely, and we want to keep hospital capacity going. And so in order to do that, we've got to follow safe practices, the stay smart rules, if you will, of the game. And whatever it is that will promote mask wearing is going to be pivotal to making sure that we can stay in this game as healthcare providers and keep providing healthcare in a way that is not going to burn us out. I mean, we do not want to have to choose between who's getting an ICU bed or not. That's just an inhumane decision for anybody to make. And so just wear the mask.
So I was going to say the same thing, of course, because I feel equally strongly about that. So what do I wish that we knew? Can you say that question again? What did I wish we knew now?
What do you wish we knew right now that we don't already know?
I wish we knew how we could define immunity and how we could measure it, and how we could quickly get those people who are immune back out into society. So I wish immunity would be, I would say, the best answer to that question, in my opinion. Are we missing it, or does it not exist?
Yeah.
Is it,
and all these questions that are circulating around the people who never seem to get it. Why is it that kids are not as likely to get it or spread it? These are all related to the immunity that is innate or is produced by having had the infection. Those are huge unanswered questions that I study herd immunity, so I deal with that one a lot. Yeah. Lindsay, how about you?
I'll take the best thing of the pandemic. How about the silver lining? I don't really necessarily want to go with best thing.
Sure.
Silver lining has been the teamwork, right? So being a nerdy girl and being an advisor for Impact, they blow everything else out of the water, just, in terms of silver linings.
Yeah, I agree.
Absolutely.
I think that's a great note to end on too. So I think we'll wrap it up there. And I want to thank you, all three of you, for joining me today. This will be posted on the Dear Pandemic website, or the Dear Pandemic Facebook site, for folks to rewatch. And I hope everybody has a terrific rest of their weekend.
Thank you so
much.
much.
Thank you for having us. Thank you.